and Human Services Committee meeting to order. Will you please stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We will move on to item number 3, public comment. We have 4 people signed up for public comment today, and we will begin with Jim, who is attending virtually. So Jim, if you would like to go ahead and state your name and address, and then you will have 3 minutes to give your comment.
Hi, my name is Jim Reitz. Do you need my address or anything?
Yes, if you could state your, I guess just municipality is needed.
Okay. Municipality is Milwaukee, and I wish to speak regarding the Community Corner Clubhouse.
Thank you. Go ahead.
Sure. Thank you. My nephew is Craig Lauber, and he's been attending the Community Corner Clubhouse for about 7 years. During this time, his family and friends have witnessed dramatic positive changes in him. Craig recently publicly stated that he has had numerous suicidal thoughts over the years, but none since attending the clubhouse. What stronger testimonial could there be for keeping the clubhouse open? There is something happening there that should be duplicated, not eliminated. If the clubhouse is to be closed, please ensure a suitable alternative is provided. It may be a lifesaver. Thank you.
Thank you. Next, we will have Mike Frankel. And I guess we're giving public comment from up here today. I guess we could handheld. And then just your name and municipality, Mike.
Hi, my name is Mike Frankel. I am the manager of Community Corner Clubhouse. My municipality is Marathon County, Edgar, Wisconsin. I'm just here today to address the board just to thank you for taking time out of your busy schedule yesterday. Thank you, Mr. Cavelli, for arranging a listening session at Community Corner Clubhouse and allowing our members to be brave and share their stories to you. That was really difficult. It was really emotional. My heart has been in Clubhouse. Well, first, I've been a North Central Healthcare employee for the last 34 years, and I've worked in all capacities of the organization, starting out in crisis and working in a group home in the last 22 years with the clubhouse. And you heard a lot of testimonial yesterday on really what impact this has had on people's lives and how it has changed people's lives in their recovery. So I'm asking for a way, for us to work together. I mean, there's no I in team, and I'm willing to do whatever we can as a team to kind of figure things out, because this isn't all about me or my staff and our jobs, because you've already heard we can be absorbed within our organization, which is wonderful. Like, I want to stay working with North Central Healthcare. I want to hopefully retire in maybe 10, 12 years. I don't know. But it's more about the members. And that's what really the essence of Clubhouse is. It's about the people that we serve. So I just wanted to share that. And again, thank you for coming and listening, because sometimes that's all people want, is just to be heard. And we had maybe 6 or 8 of board members there yesterday that really listened. And, I think for our members that meant a lot, because sometimes they just want to be heard. So again, thank you. And my door's open. If any of you want to know more or learn more specifically about the program in general, what we do, how it works, I'd be more than happy to talk with you individually at any time. So thank you.
Thank you. And next we will have Craig Lauber.
I'm Craig Lauber. I'm from Red Mountain. I've been a member of Community Corner Clubhouse for 7 years. I've struggled with PTSD, anxiety, and depression since I was a kid. I've actually attempted suicide 4 times in my life. My social anxiety was so strong, I couldn't feel safe when others were around me. For the 8 or 9 years before joining Clubhouse, I probably only left the house once a month on average. Clubhouse is a safe place to go to. Everyone at Clubhouse knows what it's like to be anxious and to go through things that most people can't relate to. There's no stigma there. Everyone understands. As one of my former therapists said, mental illness is not a sign of weakness. It's a sign of having to have been too strong for too long. Depression, PTSD, and anxiety are caused by people being put into situations they aren't made to be put in. I wanted to bring up the concept of the revolving door syndrome, which is where if someone has a mental breakdown and they wind up in a hospital in the inpatient facility, the hospital is just there to make them so they're not suicidal anymore. Then they put them back out into society, into the exact same situation that made them have that crisis in the first place. So people just tend to go back and forth like they're spinning around in a revolving door. I've been in inpatient facilities before. The first time was when I was 12. I was in Bellin Psychiatric Hospital in Green Bay. And even in the youth area, there were people there who had already been through several times like that. And I mean, if you break down the budget of Clubhouse, it costs maybe $3,000 or less a year per person. Whereas it can cost more than that per day per patient in an inpatient facility. And I have no doubt that quite likely myself and several other members would wind up in inpatient facilities if Clubhouse gets closed. Because the whole point of Clubhouse is to provide the positive experiences that break that anxiety. I mean, anxiety is caused by repeated bad experiences. And you can't break that unless you have good experiences to balance that. And Clubhouse is a very unique environment that is built specifically to do that. Regular therapy doesn't accomplish that. There are no other services in this area that are designed for that. So it keeps people out of more expensive care. So yeah, with that, I'll let the next person go.
Thank you. And next we have Bill Lauber.
Hi, my name is William Lauber, Lauber. I am Craig's dad. I live in Rib Mountain. I have been a computer programmer, a math teacher, a math and science tutor. My most recent work was at DC Everest. Working there, one of my things was I was the coach of a contest called Math Counts. 4 years in a row, the only 4 years that I was coached there, I took a team to state, which means we did well. Okay. Principal came to me later and said, look, we don't have the money to continue it. We're going to drop it. Okay. Kind of similar to what I heard here. Okay, we don't have the money, we're going to drop it. Okay, the district coordinator here in Wasa, Archie Becker of Becker Engineering, had told us that we hear that some schools are having difficulty raising funds. If you need help, contact me. Okay, I didn't contact him at the time because I wasn't aware that Everest felt they had a problem. Okay, so Everest didn't indicate to me that I should ask Archie Becker for help, the Math Counts district coordinator. Okay, Once indeed the principal tells me, hey, we're canceling this, the principal and superintendent refused to listen to me asking about alternatives such as what other kind of revenue streams are there? Okay, such as talking to Archie Becker about what kind of help he was going to offer, or what somebody like the Greenheck Foundation might be willing to offer. After all, they got a huge building with the Greenheck name on it. Okay. They wouldn't listen to any other kind of fundraising, various other items or programs. Had done things like bake sales, car washes, whatever. We were not allowed to do anything. We were simply told, you're done. Are you guys doing that here too? Are you doing that?
30 seconds remaining.
What's that?
The 30 seconds remaining on your public comment time.
Okay. Time's up, I guess. Well, thank you.
Okay, thank you. All right, that concludes public comment for today. We will move on to item number 4, approval of the August 3rd, 2022 Health and Human Services Committee meeting minutes. Those were in your packet. Do I have a motion? Motion by Arstead, second by Covelli. Are there any discussion? No discussion. All those in favor say aye. Aye.
Aye.
Opposed? Motion carries. And then if the committee has no objections, I am looking to rearrange the agenda a little bit today and move item 7B to go first, because we do have visitors here today and I'd like to respect their time. So are there any objections from the committee? No? All right, so then we will take item 7B, update on the Community Corner Clubhouse next. We have Mort McBain here with us today to start off.
Thank you, Madam Chairman. Last time I was at the committee, we talked about the fact that we were making some plans. We were looking at the options for Clubhouse. And we have some progress on that front. And I just wanted to report back on some of the things we're looking at as far as options for the services that we have at Clubhouse. And I want to give you a kind of an overview of the big picture, let's say, of North Central Healthcare and all of the services that we provide there. And Clubhouse is a small piece of that, but it's an important piece, no question. For some people, it is a very important piece of their life. There are, on average, about 14 members of Clubhouse who attend on a daily basis. And in a month, in an average month, there's about 70 people that access services from Clubhouse. The budget is $260,000, and that includes 3 full-time staff plus other costs. Clubhouse provides services in terms of vocational training, transitional employment, life support, education, and the primary diagnosis for eligibility for Clubhouse is mental health. They also take care of those with an AODA diagnosis, but that is not a primary eligibility factor for Clubhouse. Also in the community, as we've been checking around, first of all, we have an adult day services program that we operate at North Central Healthcare. We have probably 40 or 50 people in that program. We're also moving over some people from our pre-vocational program into our adult services program. And so we already offer a program that is very similar to the offerings from Clubhouse. We offer supportive employment, we offer training and life skills, but we do not serve AODA folks with our adult day services. We have to be careful that the populations that we put together, and that's by state regulation. There is another organization in the community called Adaptive Communities. They treat or deal with 100% developmentally disabled individuals. And they do serve some members of Clubhouse, from what I understand. There are people who attend both those programs. Another program that I've recently heard about and haven't checked it out yet, and that's called Opportunity Inc., and that's down on River Drive. They serve primarily the elderly and the disabled in the community. So they have sort of an adult day program too. There's also another project underway right now in the community just down the road on Grand Avenue, the Community Partners Campus. Maybe you're familiar with that project. It's being built right now. And we are partners with Community Partners Campus. We have some arrangements with them to provide some psychiatric services on a limited basis to those people who will be utilizing Community Partners Campus, or CPC as we're calling it. And the mission of Community Partners Campus is to provide a shared space facility that houses organizations serving disadvantaged individuals and families in the greater Wasa area with basic needs in a single location. Now that's kind of a very broad mission for that organization. But they include under their umbrella Catholic Charities with the Warming House. They also are going to accommodate Neighbor's Place, and they're going to have a free clinic. And as I said, we're partnering with them to provide some limited psychiatric services to clients that would access the CPC. We also have another program, I believe it's housed at the library, and that's the Marathon County Literacy Council. And I checked on the services they have. They are providing access to computers and socialization. They have a sort of a day activity going on there. They also help with housing applications, with literacy and employment skills. So they offer similar services in some ways to Clubhouse. Another organization that we've looked into is NAMI, or the National Association for Mental Illness. It's not association, I forget the word, but anyway, they're not real active in the community, and maybe there's opportunity, we're thinking, for greater activity from NAMI because they deal with and they serve the mentally ill. But just to touch on the broad overview part, our scope of services at North Central has increased substantially over the last many years. And we've reached a point where, frankly, we cannot afford to fund all of the programs that we offer. And that has led to an evaluation of some of the programs that we offer now to determine if there's a more effective or efficient way to provide those services at reduced cost. So that is where we're focusing on right now. We have not made any decisions in terms of timelines or anything. We are simply looking at the best way to offer a wide variety of programs that are essential for this community and offer those on a sustainable basis, meaning we can afford these programs. And this budget year is going to be very difficult, which has triggered our evaluation process for all of the programs that we offer now, to see if there's some way we can continue to offer the services, but maybe under a different format or a different facility or a different program in the community. And as I've said, some of these agencies operating right now in our community could assume some of the services for some of our clubhouse members, not all. But that's the process we're in now. So I'm going to stop there with that overview, and I'm going to invite Dr. Robert Guthrow to come up and help me here with questions and answers. Dr. Guthrow is our Chief Medical Director at North Central Healthcare. He's been there for several years, and he's very familiar with the clinical and programmatic services that we offer there, much more so than I am. And so I would ask that you direct your questions to us about services and programs, and he will answer those questions from the background of our clinical medical services, okay? And so and try to give you an idea of the kinds of populations that we serve and the services that we offer to those populations, and why sometimes you cannot mix those populations with your services. So with that, I'll just open it up for questions, Madam Chair.
At the risk of being thrown out of here, at the risk of
Sir, I will need you just to have a seat and stop interrupting the meeting. You're out of order. Please. Yes, could you please sit down? I understand you'd like to respond, but this is not the appropriate time to respond, so could you please have a seat? Sir, I don't want to have to ask you to leave, but if you don't sit down, I will have to ask you to leave. I apologize. This is not the time to respond. If you'd like to speak with more later, you can do that. Yes, public comment is over now.
So, questions?
Are there any questions? Supervisor Leahy, go ahead.
Thank you. Thank you. Yes, I wondered if you could reiterate the annual budget and then perhaps go over, I know you said that there wasn't really a timeline for closing, but that seems contradictory to some of the other information that's been provided. The members of this club are thinking that they're being closed possibly next month. So could there be a little bit more detail about that process? And also, is there a legal timeline in which this entity is allowed to remain in the building and operate the program in accordance to our budget? Thank you.
Good question. The overall schedule is that we do not plan to establish a budget for Community Clubhouse for next year. Another way of saying that is that we're funded through the end of the year with the program. We have not issued a date of closure, but it will be transitioned or closed by the end of the year. As I said, we're still kind of working through what are the options that we have, and that's why we haven't issued an actual closing date other than the end of the year.
Yes, go ahead, Supervisor Cavalli. Sometimes you have to give it just a...
Check. Thank you. Thank you, Madam Chair, and thank you, Mort, for presenting today. You listed several alternative services that are available in the community. Does North Central Healthcare oversee any of those?
No.
Okay.
No, and we don't have any funds that go to any of these organizations.
Okay. Thank you. So you're saying that the budget for this program is what, $260,000 for the year?
Yeah.
Out of that, can you tell us what the staff salaries equal and where we can go with, what it costs to actually run the program without the staff cost involved?
Just a rough guess. Staff are about $270,000 for all three staff. That's about $35,000 for other things to run the program. food and supplies and IT support, utilities for the facility.
Okay. And follow-up question is, for the program to run properly, do we need the staff there as they are situated right now? Or can that change to alternative staffing opportunities?
We have already offered alternative positions to each of the staff. We've made it available to them, discussions with our HR department. We wanted to make sure that the staff did not feel that they were just being let go because for one reason, we have many vacancies at North Central right now. And we can easily transition those staff over to other programs at North Central. So that would be our plan for now. And we don't necessarily feel that we have to have the same staff as we do presently to offer adult day services, offer supportive employment or skill building. We have others that are already engaged with adult day services that can run those kinds of programs at North Central. And they would transition over to Clubhouse if we kept that facility. And the chances are we would probably keep the facility. And we would repurpose it slightly to make sure that we were still offering some similar programs for the most critical clients that we have in need.
So you said you would keep the facility on 3rd Street? Is that right?
We could if that's the best option that saves us money. The bottom line for us is we're trying to set up this program to be sustainable, meaning we can afford it. Because when we can't, that impacts all the rest of the programs at North Central. And there are some programs at North Central that are mandated that we have to provide a certain level. And when we don't have enough revenue, then something has to go or be changed. And that's the stage we're at now, is looking at all those expenses and what can we do to switch this program over to something that doesn't cost us $260. Well, we already have staff in adult day services, and they're available. And some of these other community programs are also available out there. And we don't contribute anything to those programs, but they are somehow getting by without any North Central funding or any county funding.
Sure. So with some of the programs that you do offer outside of the Clubhouse, are any of these revenue-generated programs?
Yes, many of them are, other than Clubhouse.
And can you tell me how that revenue is generated?
Well, it's generated by fees and services from Department of DHS, Department of Health Services, and state. We get a lot of state and federal grants. We get a lot of fees for service. And Dr. Guthrie can probably answer that better than I can.
Yeah, we're talking about a lot of broad, every individual is unique and they have different needs and services, and Clubhouse is a wonderful thing. I mean, everybody in this room needs purpose, structure, and support in their lives to be successful, regardless of whether you have a mental health diagnosis or anything else. Clubhouse helps provide that in a number of ways, and it's wonderful to see that happens there for a small number of individuals compared to the large patient population that we serve at North Central Healthcare. Resources across the board are thin. There are a lot of services we provide that aren't being completed as fully as they could be or should be with some of our core mission. When you think about Clubhouse and what they're doing, and you see some of the areas that there are in the community where people have come together to start to put little pieces here and there, and I know a gentleman was going to stand up and say that the list that was provided doesn't necessarily match what Clubhouse does. That's absolutely correct. But this may be an opportunity for the community to come together, for NAMI to become stronger, for all this energy that we have in the room and we've had over the last few days of people that are very invested to come together and make something that maybe is more flexible and more appropriate for, the mission that's trying to be served. North Central Healthcare, no offense to anybody in the room, I mean, is part of a larger bureaucracy, and I'm sure Mike Frankel would love to be able to have a smaller, more nimble organization that was community-driven than driven by an organization such as ourselves. Now, that may not be something that can happen right away, but if the community comes together, we can make things like this happen like other communities have. North Central Healthcare, do we have any services that match what Clubhouse does right now fully? Absolutely not. We definitely have bits and pieces that can help support people that are there. If there's a will, there's a way. If depending on what this transition looks like, we will work with Mike and others from Clubhouse to see if we can design some recurring groups or recurring activities to keep people engaged so that support and structure isn't lost. But then also rely on the community a bit more to help with employment and housing and getting a driver's license and some of the other things that may be offered in a more accessible way for community organizations. So to answer your question about funding for the other services, it really is dependent on what the service is. But we are a facility that provides a lot of services. Many we get reimbursed for, often not enough. Many we don't, grant funded. It really is specific to the situation.
Okay. One follow-up question, if I could. We heard a lot of powerful testimony yesterday from the folks that use the facility. We also heard from the community partners, some of the therapy centers and the different counseling places that came in and talked as well, and they said that possibly moving the facility or closing the facility down would create possibly more issues with folks getting counseling that they needed in a timely manner, having to set appointments a week out or a month out and trying to get in for counseling, that kind of thing. Can you speak at all to that?
Yeah, I think that's a misunderstanding of what Clubhouse's purpose is. Clubhouse doesn't directly provide many of those services, and there are other avenues, I think, to have therapy appointments, to be connected with the other therapy providers in the area, including North Central Healthcare. So I think that is too narrow of a focus. I think the benefits that come from Clubhouse are what were discussed before. I thank you for sharing your story, overcoming anxiety and learning how to interact and find purpose and support and shared experience from people that you can visit with every day. That's where it's, in my opinion, much of its true strengths come from, not from the details of getting connected with a therapist. We can do that, absolutely.
Yeah, and I agree, and I think I was leading into where, maybe the environment at the clubhouse provides that situation where they can get that interaction and community involvement and alleviate some of the need to go to further counseling or further psychiatric care or whatever care they need.
Sure.
So that program actually helps provide that buffer without overwhelming, the psychiatric need for appointments and things like that.
And it does do that to an extent. Mort and I don't want to be standing up here having this conversation. We both like to see this continue. But we're talking about Clubhouse in isolation when we, run a number of programs. And when you look at the number of people served that we are trying to keep safe and keep engaged in services, we look at people on commitments and programs that maybe aren't as funded or not funded at all in a way that could help them remain safe, help prevent hospitalizations. Clubhouse is definitely doing a small piece of that, but we have other programs such as targeted case management or programs such as that we've talked to the board about in other via other avenues that would have a much more significant direct impact today. Clubhouse does all those things, but the scale is very different compared to the organization as a whole.
Supervisor Krause and then Supervisor Arstead.
Thank you. I would like to mention that ANAMI is a national organization. It's also statewide, and it is active locally here, not so much in fundraising, but they have weekly support group meetings for families of people with mental illness and also for people with mental illness themselves. So that would be a way for some of the people that go to the clubhouse to have some social interaction and some output with a group of people that they might feel comfortable with and accepted by. This NAMI does not help with training or meals, getting a driver's license and so on, unless there was somebody in that group that would be willing to reach out and help that particular person. But it is a group for support, and which would be beneficial for some of the people who might be finding that at the clubhouse.
NAMI is a wonderful organization, started in Wisconsin that now is national. And again, we have all these people that are invested. We can help some of these organizations become more relevant to the services that we're looking to fill or the gaps we're looking to fill. It can make a big difference. I wish North Central Healthcare could do everything for everyone. But resources, and we talk about money, but money is a small part of the bigger picture. Resources across the board are thin right now, and we're trying to maximize what we have to provide the best services we can. NAMI would be a wonderful partner in helping to do that and to fill those gaps.
Go ahead.
Thank you, Chair. So my question is rather than just cutting it out at the end of the year or whenever, can we cut it to part-time to work with these people to get them funneled into these other programs that will help them rather than, and maybe carry this program on a part-time basis rather than a full-time basis and have different hours to push these people that need this help and this community and this family into other avenues that we do have in our county.
I think that is something that we definitely can and should look at. As I mentioned, potentially creating, and I know I mentioned this, Mike, in the past, trying to find ways to use the resources we have, possibly in our main campus, possibly with one of another community organization as a campus out in the community, to see if we can have some kind of ongoing support structure, socialization opportunities on a recurring basis for clubhouse alumni, or just done a little bit differently. We have the current location building overhead makes it difficult to manage as it is. Could we do something scaled back and work with other partners that could fill some of those other gaps, and we could provide some core structure that everything branches out of? I think that is something that's possible that we could talk about. We have been talking about a bit. So I think the answer is a possible yes. Maybe, is that not strong enough? Should I say yes on a limited basis?
No, that's good. So the building, is that someplace where they can continue on at this point? Or are we getting rid of the building? What are your plans for the building right now?
We have no plans for the building, other than in a very general sense, if we would not operate Clubhouse there, we would probably repurpose it for some other program and maybe merged with Clubhouse or something. But Clubhouse is kind of a franchise operation, as I understand it. And I don't know that we could continue it exactly the same as it is now, but we could certainly have some of the services continue on, either maybe like under new management or whatever. But the basic services, the socialization aspect, could certainly be continued in some other way or some other format. But we have no plans to dispose of the building.
My concern are the people that spoke yesterday. It was very heartfelt, and you were there, Mort. And many of us were there. I get emotional thinking about it. But those people, they need that community. They spoke their minds. And just cutting it off, I just don't think that's an option. Maybe doing, weaning them into something else is what would be best for this community clubhouse.
Thank you. we have 4 months before the end of the year to work something out. And that's what our intent is. And we are at least talking with Mike. And I know Mike is investigating some options on his own. And that's great. We're also looking at some options, and we'll probably ramp up that effort in the very near future so that we can come up with something that's going to work. Because we agree that the services there for that group of people are important.
Go ahead, Supervisor Krause.
Thank you. At the previous Health and Human Services Committee meeting, you mentioned something about the Northern Valley Workshop, that some of the Clubhouse staff might be transitioned there, and they might expand some of the programs at Northern Valley. Is that still in the works, or has that been canceled?
We are reducing the Northern Valley Workshop contract that we have right now with our pre-vocational program. And right now, there is activity underway to transition those pre-vocational people back into our adult day services program, which is currently on the North Central campus. So that is another program that we are transitioning out of. But we're taking the clients and putting them with adult day services. And then the staff will be transitioned over to North Central to fill vacancies over there.
Maura, you've mentioned adult day services a couple of times. Could you give a brief overview of what adult day services does? What services they provide?
Adult day services, well, unless you want to.
Go right ahead.
Okay. Adult day services basically provides very similar services to what Clubhouse does. Adult day services where people come in on a daily basis and meet as a group and socialize. They have programs there. They have skill building. They have educational programs. They have employment programs to transition people into employment. So it's very similar in many ways to what Clubhouse does. They have counselors there who meet with their clients. And we have about, I think we have about 40 to 50 people in that program on a daily basis.
I will add that the population is a little bit different, mental health being the primary focus for Clubhouse. And although there may be some overlap, the populations are a bit different, where other cognitive or other limitations might be present more with ADS than. Sure, sorry about that. So the populations are a little bit different. They may overlap a bit, but ADS has a little bit more to do with cognitive limitations rather than mental health specific diagnoses.
Thank you. Supervisor Niemeyer?
Thank you. I was just wondering what kind of fundraising options North Central Healthcare has possibly looked at for this, instead of like cutting it out, maybe assisting it into a nonprofit kind of thing. Because Clubhouse, it sounded like yesterday, is a huge. It took a lot of those people a lot of courage to even step out of their homes to even go to Clubhouse. So Clubhouse is a very familiar place. So I think to move them out of that would be very difficult, and you might lose some clientele in that sense. So I was just wondering what kind of fundraising options you might have been looking into.
Fundraising for a public entity is always a little different. People assume that government has lots of money. Well, we don't. But we are certainly open to any possibilities that we could be funded by any other outside source other than the North Central funds that we get from taxes and revenue and the counties. So we're definitely open to that possibility. We are not in a position where we can go out and start fundraising as a government organization. We are at base a county department. We're a big county department, bigger than any other department. But we are essentially a county department from 3 different counties, Lincoln, Langlade, and Marathon, with shared services. It's a big organization. But we're not in a position to go out and start to fundraise from private sources. But we would certainly welcome that effort. If anybody else were out there doing that, we would want to be working with them and involved.
Can I ask just a legal follow-up to that? Is there any type of funding that you are not able to accept? Sorry
there
for
for
the
that one.
surprise question.
Hey, Before you answer, would you mind if I just added just one bit? Clubhouse has been in a financially difficult situation for some time, and I think Mike Frankel has done an enormous job working to find grants, to talk to some businesses in the community, to talk to state legislators to see if there's other options for funding that help keep Clubhouse moving forward. And at this point, if we thought that we could do that and keep it going forward next year, we would be all over that. Even right now with the 240-ish thousand that we expect to lose with Clubhouse, half of that is currently provided by the county itself.
Madam Chair, regarding your question, it's a little bit of a broad question, so it's a little bit difficult for me to answer specifically, but I guess what I'll say is twofold. First of all, as Mort was indicating, any government entity has some very specific limitations as far as soliciting private funds. That's when we're talking about the inability to fundraise. There are some very specific rules that would apply to really prohibit much in that area. As far as accepting funds, it would really depend on the source of the funds. There is a process that would need to be followed if the funds would be accepted, but it really depends on where they're coming from and what types of strings might be attached to that kind of thing. There's always an ethical analysis that would go anytime the government's accepting that type of money as well.
Thank you. And then I just had a couple other questions. You've mentioned these other organizations that offer similar services, but have we had conversations with those other organizations about kind of taking on new clients and that sort of thing? Are they interested in doing that? Do they have the
We've
capability?
just started some of those conversations, but we'll continue to talk with them and try to pin it down and get a little more specific. Right now, it's just kind of a general idea that we have because we know there are some services out there being provided right now. We don't know exactly what their capacity is or their costs to provide services or what it would take for them to accept more clients. So that process is ongoing, and I'll probably be back here in another month with a little more specificity, we hope, to answer some of those questions. We're still working on it.
Okay. And then are we able to bill for services for the Clubhouse or create a fee schedule, whether it would be, just pay as you go or through insurance?
Well, it's maybe you want to CCS or?
Not in any meaningful way.
Okay.
There are avenues we've looked at potential possibilities, but at the same time, part of the beauty of what Clubhouse is that it's not about what means you have or what insurance you have. It's an open door so people can come in. But we've looked at a number of options, and again, if we believed any of them were feasible to help make Clubhouse viable long term, we would have moved forward with them.
Yeah. Go ahead, Supervisor Covelli.
Thank you, Madam Chair. Question on if we pursue as a committee or a county board other options to fund this program, would the staff services still be provided by North Central Healthcare, or would we have to find other services for that?
If we received all the funding necessary to fully fund this program, we would certainly keep it as is. We might change some of the program aspects, but that's a decision for another day. For now, the issue is the funding.
Right.
And if we have a source of funding that's guaranteed, and we would want to, frankly, guarantee that funding source for a number of years, so that we're not back here every year asking for money, asking for more money, please keep the program going. We don't want to go through that every year. So if the county were considering funding, and I'll just ask Lance to just close his ears for a minute. If the county wanted to fund this program, then we would certainly be amenable to that. But that raises a different problem for Administrator Lance, because he's got to take that funding from somewhere else. That's what we're doing. We're having to take money from other programs to fund Clubhouse. So it's kind of a chicken and egg problem. Where do you get the money? There's not enough to go around. So.
Yeah, thank you. And I think there are funding sources out there. We just approved $5 million ARPA funds to increase the budget for the building for North Central Healthcare. So I think there are funding sources out there that we can pursue. Maybe some of the programs that we're already funding aren't using up the entire funds of the program, that we can take a look at as well. I don't know. We'd have to, get into that and take a look. But, for, the powerful testimony that we heard yesterday and the advantages of the program right now seem really good to me. I mean, as far as what they're doing over there and, the skills, the life skills that they're learning and transitioning into the community, getting jobs, driver's licenses, and things like that. I think it's a great program. And I think, as a committee and a board, we should possibly look at funding that fully. Thank you.
Thank you. Are there any other questions? Go ahead, Supervisor Niemeyer. Can you hand him the microphone?
I just want to add on to Ron's comment. I mean, like, if we're looking at ways to fundraise, ask for people to, maybe do like a 5K or something, and fundraise in those means, that'd be a great way to get knowledge about the clubhouse out too, and then maybe people would be willing to, step in and volunteer some time. Because to be honest, I've lived in this area for 21 years of my life, so I had no idea what the clubhouse was until a couple weeks ago, and we had this listening session. I was like, I'm all in. I'm going to go see what this is about. And so there's very few people, even my age, that really know about it. So I think that'd be a great way to get knowledge of it about.
Thank you. Go ahead, Supervisor Marash. Can you guys hand her a microphone?
Thank you. So with the ARPA funds, we've just approved millions and millions of dollars to put into North Central Healthcare in the last few months. And many of the members of Clubhouse were heavily impacted by COVID, and the ARPA funds are related to COVID. So would it be possible to use some ARPA funds to fund this program for a specific amount of time, say 2 to 5 years? Some of the other ways we have used the ARPA funds or have delegated them so far is with a contingency that we find matching funds. So if we are able to do something for, like I said, 2 to 5 years, whatever is decided upon, with the understanding that we find community support in the interim time while it's still running, and have a way to work with the community, find more partners, but still be able to keep the program as is, because if it change is hard for everybody. We've all experienced a lot of change in the last 2 years, 3 years. But for some people, it's much more difficult to go with the flow and maybe, go to community partner campus. That's going to throw some of these people way off. And hearing about the suicide rates, the attempts that they've had in the past, that's way too expensive in my opinion. So that's just an idea that I had. Thank you.
I think probably a question for me. So the short answer to your question about your first in a series of questions about using American Rescue Plan Act dollars, yes, you could do that. I think as the discussion has gone, the thing that I'm leaving with, the takeaway for me is that you'd like Mort, the executive committee at North Central Healthcare, and staff to continue down the path of identifying what are the alternative means over the next 4 months to make sure that we have a sustainable solution to address the challenges that the clients at North Central Healthcare and specifically at Clubhouse have, and I think we can do that. I mean, I appreciate the suggestions of fundraising, and Clubhouse were to spin off and become its a nonprofit, it stands alone, your fundraising opportunities are far broader than the things that county government and local government are able to do relative to fundraising, how you procure funds, how you report funds. So I think all those things are options. Discussion is good. I don't know that you're going to come to an answer today. I think what I hear is, again, to sit down with Mort, and I can continue to do that, to figure out what those next steps look like to address a need we have in the community, while also, I think, putting my administrator hat on, I didn't cover my ears like Mort said, making sure that to the greatest extent possible, we don't duplicate effort in terms of county tax dollars with already existing programs and services in the community. It's a much better approach to have that synergy and support, because as Mort alluded to, we do recognize that resources are limited, both in terms of financial, but really in terms of people right now is a real challenge. So we'll continue to do that. As Mort said, we do have 4 months. I think the discussion at the North Central Board, and I do serve on the North Central Board, I know Kurt does as well, Supervisor Leahy does. The discussion was, to get this moving, this discussion about, okay, in light of the financial situation at North Central Healthcare and the need to focus on those mandated services, what do we need to look at in terms of ways to do, as I've said to this committee before, model delivery changes. How can we keep the program, change the model that we use to deliver it? And I think we do have some options, like Mort said. So we'll continue to do that. But the short answer to your question about encumbering ARPA dollars, certainly you could do that. My hope and my goal in working with Mort is going to be that you don't need to do that. Because if you don't already know this, you have far more requests for ARPA dollars than you have ARPA dollars. These conversations are going to continue. Because the reality is all the programs that North Central offers, as the doctor referenced, and all the services at the county that you offer, there's a lot of these type of stories because we do a lot of really good things. That mission is a really good one. There's not anything that we do that doesn't impact people's lives. So we'll continue to work and we'll bring it back, but I think, as Mort said, we'll be back next month with hopefully more information.
Thank you. Are there any other questions? So then before we end, I know both Covelli and Arstead, you spoke about the listening session yesterday. Is there anything else that you wanted to add for the people who weren't able to attend?
Thank you, Madam Chair. So the listening session was a packed house. A lot of the folks are here today. Not all of them, a lot of them. And I have petition here from the Clubhouse closing of community, that they oppose the closing of the Community Corner Clubhouse. So we can, if we want to put this in the record, I would suggest that we put it in the record that we do have petitions to keep it open. And I'm guessing there are a couple hundred names on here. We also have testimony from folks that use the Clubhouse and have used it in the past and have been successful in life after using the Clubhouse, but they still stay in contact. So, if we want to put this in the record, we can do that as well, which I would suggest. And then we talk about our strategic plan. Our health and human services goal is for Marathon County that promotes the physical, mental, and social health of the community and takes steps to support healthy living for residents at all stages of life. And then objective 3.7 is develop a continuum of services within a therapeutic community. So those are important strategic plans for us. And I think this program, outside of a state mandated program, fits that strategic plan very well. So I would suggest that we take every effort that we can to fund this program. Thank you.
Thank you. I appreciate that summary. Oh, go ahead, Supervisor Arstead.
What Ron said was true. It was a great, insightful meeting, and there are some brave souls there that spoke. And after the meeting, I had many people come up to me and talk to me because they were afraid to speak, but they wanted me to know their story. So these are people that need community, and Community Clubhouses is giving them that. So hopefully we can either support it or come up with another alternative to help them or fundraise. Thank you.
Thank you. All right, were there any other comments before we move on? Oh, go ahead.
Sorry, I just have a lawyer thing. Technically, we don't have a record to enter those documents into. It can certainly, though, be noted in the minutes that they were referenced. So I think that would probably be the best way to make a record of that.
Thank you for that clarification. All right, so then we will jump back to item 5, policy issues for discussion and potential action. 5A, the discussion and possible action on the 2018-2022 strategic plan.
If I may make a suggestion, Madam Chair? You have a couple other guests here for item 7A relative to the presentation from the task force. And no offense, the committee is, you are captive for the entire meeting.
Supervisor Robertson and Mayor Rosenberg said they would love to hear about our strategic plan. All right, so if there are no objections from the committee, then can we move item 7A ahead of the strategic plan? All right, sounds good. Then we will move on to item 7A, presentation of Wasa Policing Task Force findings. We have Supervisor Robinson and Mayor Rosenberg with us today.
Well, thank you, and Deputy Chief Barnes appreciates your moving us up so that he can move on to other things. I'm here today not as a member of the county board, but rather as I have the honor of chairing the Wasa Policing Task Force, which was created a couple of years ago to look at opportunities to improve policing in the Wasa Police Department, partly in response to activities that were taking place on the national level, but also in the guise of trying to look at continuous quality improvement and seeing what could be done better. So the City Council and the Mayor initiated the process, and they wanted us to go through a deliberative inquiry process of what do they do in the police department relative to current policies and practices, and we spent a lot of time looking at all of the policies and practices. Why do they do it? What are the community's expectations and assumptions? And we'll talk a little bit about how we engage the public, and what are we missing in terms of services, which is why we're here today before a county committee. The task force had 13 different roles or responsibilities and duties that it was tasked with, including an evaluation of all those policies and practices, and looking at mental health and social service issues, and look at training and other factors that went into how do we put together the police department, how do we train them, how do we continually work with them, how do we address community needs and other things. And we were tasked with developing a series of recommendations. So we had a 7-person committee or task force made up of myself, Pat Peckham, a member of the council, Michael Loy, a citizen and member of the Wasa Police and Fire Commission, as well as Will Harris, also a member of the Police and Fire Commission. Citizen members Kaylee McCauley, Sarah Schneck, and Michael Kemp North, all bringing different perspectives and valuable insight. We had 24 meetings between September of 2020 and the summer of this year, and we looked at how do they work? How does the police department look? We spent a lot of time looking at their policies and procedures manual. We had 2 thumb drives full of data in reports and policies and procedures. We also spent time looking at the President's Commission on Policing in the 21st Century. We looked at recommendations from the Wisconsin Professional Police Association, Blueprint for Change, and we looked at the Speaker's Task Force recommendations. We invited a number of people in, including Jim Palmer, Executive Director of the Professional Police Association, in. We contracted with WIPS, Wisconsin Institute of Public Policy and Service, to engage the community in discussions about policing and what their expectations were in feelings. We invited representatives from the county, Chad Billups, and others from the Sheriff's Department, the DA's office, North Central Healthcare to talk about programming. We evaluated the jail and the programming that are there. And we spent a lot of time looking at the various programs that were available. We did all members were encouraged to do ride-alongs with the officer. I did 2 of those, and within half an hour of each, you found out that police officers were mental health officers or professionals and social workers. It doesn't take long for them to engage people that have needs beyond what the police are trained with, and we're going to spend a little bit of time talking about what those needs are going forward. But we spent a lot of time engaging the public, looking for input, and that process of civic engagement started out, unfortunately, limited by the pandemic through a series of listening sessions, a couple in person, but most virtual. Those results were used to develop a survey, and we had 1,350 approximately responses from the community providing their views on it. From that, we found that there were some differences in results depending upon social, economic, and demographic data. We wanted to drill down a little bit better to get a better understanding of those, so we set up a series of focus groups, including focus groups with the members of the Wasa Police Department. But again, we had a large number of contributors that came in and presented to us and shared their information. And again, we had the sessions, the survey, the focus groups, and we looked at other ways to collect the data. And you've got the dates in there, and I'm not going to spend a lot of time on those. But what were our findings? We didn't find any evidence of systemic racism, which is one of the charges. But we also found that residents were very satisfied with the performance of the police department. And again, there are differences depending upon what your background is. Mental health and addiction resources are a top priority of the citizens of the county. And 95+% of the people that responded to the survey were Wasa residents. It probably wasn't a complete reflection of the community, but I think we received enough information on which to move forward. And I think really what we want to do today is to spend some time on the issues and the recommendations. And I'm glad Matt's here today, because Matt was really instrumental in bringing forth many of the issues, and supporting what we had heard from others. But we heard that there were need for mental health and human services, the expansion of services. One of those areas is in crisis assessment response team, and we'll spend a little bit of time on that. But we also have a need to take care of our own officers. And I think what we saw for the police department is reflective of the needs of the sheriff's department. So I would encourage you, when you look at what the findings were, to think about how law enforcement in general responds. They're in very traumatic situations. They get called out to investigate rapes, homicides, very stressful situations, and are under significant pressure from the public because they can never do anything right, or they can never do anything wrong, but they're in situations that are many times no-win situations. We need to make sure that we support them going forward. We also spent some time talking about the importance of cultural competencies and understanding the public and the community in which they engage and interact. And there's a need to continually involve the community in discussions. And we're here today primarily because of these recommendations in terms of mental health and human services. We have a very successful project or program right now called the Crisis Assessment Response Team, where we match somebody from North Central Healthcare Crisis Services with law enforcement at both the Sheriff's Department and at the Police Department. The problem is that that's Monday through Friday during the normal workday. And what happens beyond the normal workday? Crisis services, need for crisis services. And one of our recommendations is to expand that crisis services and to, if we can, 7 days a week and get it into the second shift when a lot of those interactions occur and there's a need for that support, the support service. We need, one of the things that the Wasa Police Department was a leader on was engaging the homeless community through Officer Lemeron, who worked very closely with them. But the department made a decision to repurpose that position, move it back in, and there's a need for a social worker to engage that population, and that position has been funded within the police department. One of the critical needs, and what we see, and if you talk to Chad and if you talk to people at North Central Healthcare, there's a revolving door. There are people that come in, present themselves to the jail, are discharged, go out and have mental health situations, go to North Central Crisis Services, get back out and come back in. And there's a lot of shared names on those registries or rosters. We need to have in this community a case management services that support those people when they leave. There's currently a discharge plan when you leave the jail where you try to match people up with some of the needs. It's not complete, but there's a need to better manage those people, whether it's medications, making sure they get to their psychiatric or other services that are their need there, or other services that support them and keep them out of contact with law enforcement in the crisis system. One of the things we spent a lot of time talking about was the 5115, or the commitment process. There's currently, it's broken. So somebody in the Wasa Police Department makes an arrest or makes a stop, not an arrest, because somebody has a mental health need and they're in immediate danger to themselves. They take that person, they transport them to the North Central Healthcare, and then they wonder, is the person medically cleared? Is the person not medically cleared? Do we deal with them in Wasa? Do we send them to Winnebago? There are a lot of problems in that area that need to be resolved, and those resolutions need to come from the state legislature in terms of clarifying the law that drives that behavior, because the current system isn't working, isn't effective, and takes a lot of police time waiting for the decisions to be made. And we need, it's an issue for the Sheriff's Department and others. I think there's a need for legislative intervention. And we also made a recommendation to engage MetroRide, or the local bus system, and transportation services to the homeless to make sure that they can get to those appointments, hopefully result in an improvement in their lives. Again, in the area of officer wellness, we talked for the police department about having a specific employee assistance program without co-pays and deductibles for those officers who need mental health services. It's important that we remove the stigma, but that person that they consult with have forensic background and understands the criminal justice system and law enforcement perspective on that to be able to support them. We also think that it's important to have annual cultural awareness education for officers, and expand and invest in mental health training resources. In terms of cultural competency, the city, along with the county, have access to interpretive services. That needs to continue. And we also thought it was important for the law enforcement to understand basic phrases in various languages. We have a growing Hispanic community. We have an Afghani population that we need to break the tension of the arrest, because when people are arrested, they're many times very uncomfortable, agitated, concerned. By speaking just a sentence or two in their language helps diffuse that situation. In community engagement, the city has a very successful neighbor-to-neighbor program where they sit down with neighborhoods and engage them in what's going on. We thought that it was important that be expanded into other groups, whether Black, Hispanic, Hmong, LGBT, new refugees, or others. And the department is going to look at how they can just have a dialogue with them. And let me just go back a few years relative to the Hmong and the whole issue of how do we approach domestic abuse. The domestic abuse in the Hmong community was handled through the clan leaders. That's not how we handle domestic abuse situations under Wisconsin law. There is a formal process, and there needs to be a dialogue with the communities to understand the different perspectives. And that happens when you have these ongoing discussions. Develop multicultural, multimedia communication policy. One of the things we survey people is how do they get their news? And we found that they don't get it from newspapers anymore. They don't necessarily get it from social media. They get it from all sorts of different areas. And it's important that you communicate in those venues to make sure that's out there. Continue partnerships with resource organizations so we understand the latest trends, whether it's the President's Commission on Policing the 21st Century, the Wisconsin Professional Police Association, and others, just to make sure we know what's there. And then we also thought it was important that we conduct a public service campaign about interacting with law enforcement. Everybody talks about their rights. Nobody talks about their responsibilities in a free society, and there are responsibilities for us as members of that free society to engage law enforcement with respect and have an understanding of what that is, and we think it's important that we have some dialogue with the community. And then we also want to replicate that survey on a regular basis to find out whether the satisfaction is there and continue going forward. We've prioritized the human services, but the reason we're here today is that there are dependencies. The city of Wasa can't do this alone. They need other partners to come to the table, as you heard earlier today. Whether it's the city of Wasa, the Police and Fire Commission, North Central Healthcare, Marathon County, the state, or the public, there are numbers. We're here today to ask for the county to consider expansion of the crisis assessment response team, to look at the case management, to help us with the 5115 rewrite and get some clarity, but to support some of the other recommendations. So we will be going before North Central Healthcare, the Community Services Board, and making these requests and looking for funding. But we think it's critical. Again, in those ride-alongs and other discussions, the first thing we hear or first thing you observe is how prevalent alcohol and other drug abuse and mental health services are, and who they're engaging with and what their needs are from law enforcement. And they're not the mental health professionals nor the social workers, so we have to figure out a way to support them in those positions. And Mayor, I'll turn it over to you.
Sure. Thank you for letting us present today. First, I just want to say that one of the things that we discerned from this data and our engagement was that not a lot of people tell the difference between Wasa Police Department, the Sheriff's Department, Everest Metro. The police are the police. And so I think that we can all be very proud of the behavior of our local law enforcement and how they interact with our community, because everyone said they trusted them. And I 100% trust our Wasa Police Department, but it was nice also to hear that overall everyone is quite trusted. So good work on the policy guiding all of our law enforcement agencies. But I want to just underscore some of the things that Supervisor Robinson said, and that's CART. I mean, it's a 24/7 deal. We need it. We need it to be a little bit more robust in that programming. It's really great for what it does. Just yesterday, I had a guy email me, and he said, I'm homeless. I have a child. I don't know what to do. And I was able to get in touch with one of our CART officers, Officer Lemerand. He's amazing. And he immediately got in touch and said, how can I help you? Give me more details. And we want to make sure that we're able to have case management like that, be able to address those concerns right away, not have to wait until Monday. So it's really a big deal, and that's probably the biggest deal, I think, that I would want to underscore. But also, when it comes to North Central Healthcare, having support via case management is really important, being able to follow up, being able to make sure that we're part of this ecosystem to keep people healthy and in our community. So I think that's going to be a big part too. So that community-based case management, you might recall last year or the year before, the pandemic years kind of roll together for me. But we went together with case management for folks, and North Central helped us check in with people. And for some of those people, it was life-changing. They were able to change who they were hanging out with because we got them into a house. They were able to follow up with their counseling appointments and get jobs and things like that. So some of this stuff really does require that touch of our mental health agency here, and right now that's North Central Healthcare. So we really want to make sure that we're partnering together on this.
Well, to start, I'd say it was a tremendous joy and a lot of fun having a task force look at everything that you and your organization do. Thanks, John. That was sarcasm in case you don't know me. Just a couple of key points here that I think are important to clarify. The 5115 system relies on a law enforcement signature to be able to chapter someone. And there are states that do a much better job than us. And, you know, you don't call a carpenter if your pipes are leaking. But yet we call, like if I try and put a 30,000-foot view on this, we ask our police officers to respond out in the field to these situations and address the mental health needs and kind of do an in-the-field diagnosis and determine who needs to go where and do a threat assessment and how much of a danger to themselves or others are they. Well, we're the carpenter trying to do plumbing. And that's always been a frustration and a challenge for law enforcement. And so that would require significant change in how the state does the mental health commitment across the board. So there's a lot of work to be done there. But in the meantime, we have to function within the parameters that are established for us. So I see Laura Scuderi is on the side there. She was instrumental in starting the CART with Chad Billup and the partnership between North Central, the Wasa Police Department, and the Sheriff's Department. And one of the things that we're tasked with is the least restrictive, I'm going to use the word enforcement of people's mental health. That's not a great word, but the least restrictive environment possible, which means if they can go and receive services voluntary, that's preferential to us taking them into custody. And so as part of that least restrictive, we have taken it upon ourselves to realize it's not only, I mean, as I was listening to the previous discussion about Clubhouse, we want to do what's the most cost effective, what's the most efficient, and what's the most effective. And we know that those individuals that are struggling with mental health challenges that could be suicidal or a harm to another person, way better off dealing with the problem, and it's cheaper and more effective to deal with it on the front end and to be able to maintain a level of success where they're not in crisis than it is to try and deal with them when they are in crisis. That's not only for the cost of hospitalization, that's for the cost of our police officers, because it might surprise some of you that if an officer starts their shift at 6 in the morning and they're dealing with a crisis situation and someone that they're going to take into custody at 7 in the morning, they might be not getting home till 8 or 9 at night by the time they're done with medical clearance, transports, getting everything that needs to be done. And that whole time, that individual's in the custody of our officers. So we start out with a shift of staffing and 2 or 3 crisis calls during the day, and we're down to like, we have 2 or 3 officers left in the city. And that's very difficult to run a police department that way. So we know that our CART team being available during the day, they get to go out, they're familiar with those individuals, they make contact with them in advance and on a regular basis to help maintain their level of being able to function in society. And that takes 2 teams, so a sheriff's deputy and a mental health caseworker, and it takes a police officer and their partnered mental health professional, and they're busy nonstop for their 8 hours a day during the day. Come 4 or 5 o'clock at night, we still have people that are in crisis. So I think our perfect scenario is to bring mental health professionals into the police department to serve the entire county, because that's what they do, for the second shift, and then another half a FTE, so kind of 1.5 FTEs to cover weekend hours, because people go into crisis on weekends. And we've just seen that be so successful, to be the least restrictive and get the best result. And when you see a great program, I think you invest in that. And we experimented and we found that it's highly successful, and we have a desire to expand it. And then just for clarification on the case management, North Central Healthcare has a pile of case managers there. What we've learned with the homeless population and people that suffer with mental illness is scheduling an appointment for someone at a facility somewhere 3 weeks in the future. Like, they're really struggling to know what they're going to do next hour or next day. The amount of no-call, no-show for that population of individuals is significantly high. So what we really want in case management is community, meaning meet those individuals in need where they are. So we have someone starting tomorrow that's going to be homeless outreach individual. Like, they have a desk at the PD, but we've made it clear, like, if you're at that desk a lot, you're not doing your job. And I think we need the same thing through case management. So if someone doesn't make an appointment, where are they? Let's go find them, because they're likely heading down a path that we don't want them to go down. That's going to be very expensive to the county at some point. So how do we how do we intervene and get a positive result with that?
I guess I just want to add one more thing. When I was on the county board, I did a couple of ride-alongs, one of them with the sheriff's department. So if you want to know what this is all about, ask if you can do a ride-along and see what this is like. The couple that I did with the Wasa PD, immediately we were responding to mental health calls, children, juveniles, and it's heartbreaking. And this is the stuff they're working through every day, and we want to make sure that we're serving the community so they can be strong and be in these seats in 10 years.
I'd give a public invite to everyone in the room. You're all welcome to do a ride along.
You're
They're
going to
a lot
want to
of
say
fun.
yes to that.
You might make a career change. Come work for us. We're recruiting.
Oh, well, to bring it home, why are we before a county committee with the city recommendations? Because many of the issues that the Wasa Police Department are shared issues with the sheriff's department in all communities in the county. If we fail at trying to address the mental health needs, the people either wind up in crisis or in jail. That costs the county money. So we need to be better stewards of how we allocate those, what programs we design to meet those needs, and how we go forward in a deliberate manner. And so we're here today to ask for consideration of the CART expansion, the case management, and reworking the 5115 system support so that we can free up officers at all levels. We can provide the care that's needed. We can avoid crisis intervention at a high cost, and we can avoid incarceration for many of those individuals.
Thank you. Did you want to say something?
No, I don't know if there's questions I should answer or if anybody.
Are there any questions for the team that worked on this? Oh, Supervisor Krause, go ahead.
Thank you. Yes, I have a question about Metro ride transportation for the homeless. I haven't heard anything about that, and I'd sort of like to know what it's about.
I think that was one of the needs. We were tasked with trying to identify service gaps. And one of the gaps that we saw, unfortunately we have a transportation system that was designed in the 1950s and hasn't kept pace with the location of facilities, location of jobs, and others. So there's currently a transit study that's going on, making recommendations, and the hope is that they can, when they're dealing with those recommendations, look at some of those specialized needs and making sure we provide the services that get people to the services that they need, that the routes are appropriately designed, looking at fixed transit routes or microtransit and some other things. So that is a recommendation that has been carried to the Metro Board. Hopefully they will address it going forward.
I can also say that I'm impatient, and obviously waiting for the Metro Board to decide on something isn't really going to work for me. So one of the things that I did was I talked to some mayors who were dealing with some other similar issues, and the mayor of La Crosse told me one of the things that really made an impact was being able to give bus passes to our homeless folks that they were dealing with, so they were able to ride the bus to job services, mental health, whatever it is. So that's something that I think once we have our homeless outreach specialist on board, she'll be able to assess some of these folks, and she'll be able to help us get bus passes into their hands. I don't want to say that's exactly what we're doing, but that is my vision, and I think that we've come to a consensus as a city that that's a direction we'll be moving.
Just one observation that I'd like to share, and I neglected to do it in my comments, but when we started this process, my conversation with the mayor was, I will do this if we're going to be objective and we're going to try to make the recommendations and look at things. And I think we did that as a task force. But what impressed me throughout the process, particularly when we focused on the police department, was their commitment to character and the development of character. If you don't have character, you don't get hired. And you can't teach character. And what came out loud and clear to the benefit of this community is that they have a very dedicated force that is committed to serving the needs of the people, but their character is exceptional. And I think that is a reflection of the leadership that we have at both the city and the county level, that we don't have the George Floyd situations here, that we have people that respond appropriately and are trained, and the commitment to training and development is paramount, and we are the beneficiaries of that. When we looked at those national studies for the Wasa Police Department, use of body cameras, how they respond and track use of force, Wasa was ahead of the game. They had, you started, we should do this, we're doing it. We should do that, they're doing it. And it's a good reflection on the leadership in this community, and a good comment on the character of the leadership.
Did you have a question? Supervisor Covelli, go ahead.
Thank you, Madam Chair. So it sounds like we got a theme going on today with our meeting with mental health. And I agree totally with your assessment and your outcomes, and I think it's a great program that we're doing with, I believe it's called CART, is that right? So I think that, with what you said about, the revolving door, right? And we heard that theme for the community clubhouse member. We heard it from him. My question is that, have you, and you talked about, trying to get these people treatment at no cost to the county, which, I know the community clubhouse is a cost to the county, but the revolving door syndrome seems to be reduced by referring people to the community corner clubhouse and the program that they run. So I think there's some parallels going on with that. And I don't know if through the CART program, if anybody has ever been referred to the community corner clubhouse through that program.
And I can address that. Like the Wasa Police Department, I've gone to the community corner clubhouse with all my peers, and we've cooked lunch for them. We're pretty engaged with the community corner clubhouse, and we do utilize that as a resource for individuals that we find where we think that would be a benefit. I think it's important, and whether we're talking about homelessness or people with mental health challenges, one thing, and I've been around for 23 years here, and one thing I've learned in that period of time is there is no outline blueprint for how to provide services to all mentally ill individuals or all chronically unhoused people. Each one has their own story, their own issues, and they have a very specific individualized path to improvement or success. And the challenge is that it could be the clubhouse, it could be CART. We had an individual that we were hospitalizing every 10 days or so, meaning hospitalized at North Central Healthcare. Our CART team realized if we stop by and see the guy about every 3 or 4 days and just spend 15 or 20 minutes seeing how he's doing and provide that interaction, then he went 6 or 7 months without being hospitalized. And I don't claim to know the cost of hospitalizing someone. This individual was not gainfully employed. I'm pretty sure he wasn't paying invoices that got sent to him. So how is that covered there? So those are the savings that we see. And the revolving door really involves 3 or 4 different community partners. Every one of them involves Aspirus or a hospital and the associated costs of that. It involves our jail. It involves our on-the-street staff, officers. It involves North Central Healthcare. And if we can make a positive impact, even in a small number of those individuals, the end savings, I think, are really significant. And I'm not even talking about money. I'm talking about these are people's children. They are people's parents. They are members of our community. And when we get someone who's not successfully being a citizen in our community, and we get them to where they're being productive, like that's a giant win, and it doesn't even have to involve the jail or North Central.
One of the things, I think it might have been 2 weeks after I was sworn in, the deputy chief and the chief brought me to the Scott Street Bridge. They're like, you gotta see what's going on here. And when we were down there looking at things, a woman came up to us, and she was under the influence of something. And, she admitted that she had some addiction problems. And she was telling us that, last night I didn't want to sleep outside, so I tried to get arrested. They wouldn't arrest me. COVID is keeping me from being allowed to be arrested, because that was her shelter. And at that point, we invested a lot of time with this woman. And we were actually able to understand her story and connect with her family that she had been disconnected with. We got her back home. And I know that she still checks in with Officer Lemoran because she feels very supported by him, even though she's in a completely different state now. But when you think about the fact that, she was actively trying to be arrested and she was addicted and under the influence and just not living her best life, and now she's able to get the treatment and spend time with her family and find that purpose, like that matters a whole lot.
Let me just say that we don't take members of our homeless or unhoused community and ship them to other states. There are states that function in that. In this particular case, we arranged for services and family in California. And in order to make sure that that got accomplished, we put our staff on an airplane with her. They got to fly to LA. They got to spend 20 minutes there and then turn around and fly back from LA as they did a handoff to the next service provider. But there wasn't anyone else in our community that could do that. And this individual was in our emergency room once a week. She was in our jail every week. And North Central Healthcare was having to provide services on a regular basis. So, and she's sober today, a year later. So how many wins like that do you need in order to be able to fund some of these projects or these initiatives? I guess that's the question that you as policymakers have to decide.
Thank you. Go ahead, Supervisor Krause.
Thank you. Definitely, drug overdoses and the use of illegal drugs leads to crises. But what about the situation where you may have people who are getting prescription drugs for their mental health issues, whether it's depression, schizophrenia, anxiety, bipolar, whatever it might be? They're having a crisis because for some reason the drug is not the right drug, it's not working, it's not the right dosage, whatever. How many of those cases do you think that you handle, and how do you handle them?
I think it's probably more common than not with people that have mental health diagnoses when they're really struggling, that they are either misusing their prescription medications and or self-medicating with illicit drugs like methamphetamine, heroin, cocaine, things like that. And that's where each individual, and you need to have professionals, our police officers aren't the ones to try and figure out what's going on, how they're taking their medications. The vast majority of people with schizophrenia or significant mental health that I've dealt with in my career do not like taking their medications. Okay, it's not something that they want to do. So part of the community outreach is making sure they're taking their medications, connecting with them, showing them the upside of taking their medications so they can function in society appropriately. So if the question is how often do we see that as an issue, that's a constant issue with the majority of individuals that we deal with.
Go ahead.
Thank you. I know some of these antidepressants are known to actually cause an increase in depression and suicidal thoughts. I know of some who have committed suicide because of their prescription drug not being helpful, but putting them in a worse state. And so I'm just wondering, because medicine is always advancing, and I know when you have an infection and you get an antibiotic, sometimes it doesn't work, or you get bad side effects like vomiting or diarrhea, whatever it might be. Do you run into cases where people are having an episode because of the prescription drugs they're taking is giving them a bad effect or not working?
I think we're getting into how do we provide care to people that overdose and others. And again, that's why they created the crisis assessment response team, to try to get them to the appropriate setting. I think those are issues that are best handled by their provider and others, and was outside the scope of what we did with the policing task force. I think what we're trying to do is make sure that when that call comes into 911, they are dispatched and they go out unknowingly many times to their situation and need to respond. Sometimes they will deal with repeat offenders and they'll have an idea, which is why we're asking for an expansion of CART. But the true, what drugs are used, what the effects are beyond the scope of the police department and our task force.
Thank you. Could I just get a clarification for the CART team? Do they work with any other police departments in the county, other municipalities, or just Wasa and the Sheriff's Department?
So the vast majority of the calls for service are in the city of Wasa, but the CART team is authorized to respond countywide.
Okay.
And so in that particular situation, our CART officer is deputized, so they have jurisdiction to go and provide CART services anywhere in the county. And we have the deputy that's dispatched to calls within the city of Wasa, and we have our Wasa officer assigned to it that might get sent to Edgar to go help deal with someone. So they're all jurisdictions.
Thank you. Are there any other questions? Supervisor Covelli?
Thank you. You said you're looking for an expansion of the CART program. Does that include the cost of the program as well? And what would that cost be?
We had some preliminary discussions with Dr. Jethro and others at North Central, and we didn't finish those discussions. So it depends upon, is it 2 shifts? Is it all hours of the day? I think the request was if we could cover a second shift in weekends, that would be great. And we were beginning the analysis of, is there a revenue stream? And in some situations there is, and in some situations there isn't. There's the inability to pay. We never really flushed out the budget. There is a cost, and there will be a levy support component to it. I think the city has expressed a desire to put some money or some skin in the game for that expansion. But I know that if Sheriff Billop or the Deputy Sheriff Billop were here, he would be supportive of that effort as well on a countywide basis.
Follow up to that, is this run through the North Central Healthcare budget or the Marathon County budget?
Both. The North Central Healthcare budget is comprised of a county allocation each and every year. So essentially, Marathon County is paying for the Marathon County Sheriff's Deputy. You do that through your annual budget through the Sheriff's Department. You're also paying for the crisis professional that is both with the Wasa Police Department and with the Sheriff's Office Deputy through your allocation to North Central, and the other funding that North Central draws down, as former Administrator McBain referenced, from the state of Wisconsin.
The Sheriff's Department and the Police Department have costs. Those costs for those officers, the training, dedication, commitment of that officer are borne by those departments.
Great. Are there any other questions? Thank you all for joining us today.
Thank you.
And I'm guessing we will see you in the future. Okay, looking back at our agenda that has gone off order today, I believe we are now moving back to item number 5, policy issues for discussion and potential action. 5A, discussion and possible action on our 2018-2022 strategic plan. You will have seen in the packet that Vice Chair Arstead and I put together a draft for the changes recommended by those of you who emailed us in time, and then the conversations we've had over the last few months. We put together all of those into a document. I think what we're looking for in our discussion today would be to begin with a motion for that draft, and then from there we can go ahead and make amendments to that as the committee wishes. So is there somebody who would like to make a motion for that draft of the strategic plan? Okay, Supervisor Arstead, second by Supervisor Krause. All those in favor say aye. Aye.
Aye.
Opposed? Okay. Oh, no, we probably shouldn't have voted on that yet. Okay, so we have the motion then. We will continue with discussion then if there is any discussion that the committee would like to have or amendments they would like to make. And I think just depending on how the conversation goes, we can do those amendments in one lump sum, or we can do them separately depending on the will of the committee. So are there any comments or changes people would like to see? Supervisor Krause?
I was impressed, and I don't have any ideas for changes at this time.
Thank you. Okay, so if I'm understanding correctly, the next steps, if we approve this today, would be these are all going to the executive committee from each standing committee, and then the executive committee will make a recommendation to the full board. Is that correct? Yes,
The
I'm
administration's
seeing.
understanding, that is correct. I don't know if Chair Gibbs has anything else.
No, the committee of jurisdiction for the comp plan is the executive committee. So the recommendations will be taken from each of the standing committees, brought to the executive committee. The executive committee will take up all of the proposed changes that are being offered by all those committees. And if there's recommendations from the executive committee, they may make some changes and then forward the recommended final draft changes to the full board for its consideration to adopt and or change at their will.
Okay. Thank you. All right.
And
so
I did, if I might,
Go ahead.
Madam Chair, I did have a discussion with the vice chair who is in charge of the oversight of the strategic plan. And most of the committees are now at the same place as your committee is, and that is offering up now their amendments. And so a lot of those committees are done, and the hopes is that we may be able to look at this at the September meeting, but no later than the October meeting for sure.
Great. Thank you. So seeing as there are no further comments, then we will take another vote just
Madam
to be
Chair,
official. Oh, go ahead.
Sorry, I'm not in your field of vision. I did have one thought that I spoke with Director Vicki Tilka from Social Services on the outcome measure. I believe it's number 2 for objective 3.3, and I appreciate that the suggested modification is to identify a percentage drop with the idea to really search for those data, that data that really shows the impact. In speaking with Director Tilka, she thought there may be a benefit from kind of building on the conversation that Chief Deputy Barnes, Deputy Chief, excuse me, I always get those mixed up between the Sheriff's Office and the PD. Deputy Chief Barnes referenced about the idea of least restrictive. We have the same sort of idea as it relates in the field of child protection, right? So if you remember in the budget document that everyone has always seen, the child placement, the out-of-home placement chart that's in there, it's listed in kind of a hierarchy of the restrictive nature of the care. So you start with an in-home placement, which is not, of course, out of home. Then you have placement with a family member, with a relative. Then you go into foster care. Then you go into a higher level of foster care, treatment foster care. And similarly, on the youth justice side, you kind of ratchet up from those same placements to shelter, to secure, and ultimately to Lincoln Hills, for example. So some emphasis within the outcome measure, and this is some language that Director Tilka put together, the idea that out-of-home care days will decrease with an emphasis on reduction on the most restrictive and expensive placement types to transition to more family-like settings. It's been my experience with staff that, when you really are very clear as to what the goal is, we do a better job. We could have a reduction in the out-of-home placement by 10%, but if we shift the wrong way, we send people to more restrictive, high-cost placements, that's not a positive thing for the child or the county budget, because more restrictive placements, you like to have kids move in the other direction to ultimately go home. So I don't know if that's something that you can, that you're interested in trying to incorporate, and staff can certainly, I can wordsmith that if you're interested in doing so, but I wanted to at least make you aware of that discussion.
Okay, so what you're saying is by us putting that, the wording that we have in there, we could potentially be creating a more expensive situation for us because we are trying to.
I don't necessarily know that you will, but is your intent really the 10% reduction? Or is your intent really to aim for less restrictive, less expensive placements. My sense is it's the latter rather than the former, because you could have, it's not necessarily just the number that matters. It's the restrictive nature of the placement.
Yes, and I think that was our intention, not just an overall. So would you want an amendment then here before moving it on to the executive committee?
That would be fine, and I'd be happy to wordsmith it, so perhaps, and Corp Counsel's not here, so I can feel free to play lawyer for a minute.
Yes, do you have, because I can make that amendment, but I could not
email-
keep up with what you were.
You can email me the document and then I'll do it.
Okay. You're right.
But
You're gonna do
if
it right now?
someone were willing to make a motion to amend outcome measure 2 to insert language that emphasizes the aim of the measure to reduce the restrictive and expensive placement types, I can wordsmith from there.
Was that a motion, Supervisor Krause?
Am I supposed to rephrase it? Is that what I'm?
No, I think, from what Administrator said, we were looking for a motion to replace the language in outcome measure 2 to what he had just stated.
Yeah, I have a concern about that because money might be an issue, but what's best for the child? So I would say there will be an appropriate reduction. Appropriate. It might not be just because it's a lower cost for the county, but it's the best situation for the child. So I would say appropriate reduction.
And just leave it at that, not including the, to reduce the restrictive options, going from least restrict, or going to a less restrictive option?
I don't think we should make that decision. I think it's something that should be made by the social workers or whoever involved in that.
Thank you. If I can,
Go ahead.
Madam Chair. I think that's a great point, and I perhaps was inartful in my suggestion. Certainly, social workers are making placement recommendations based on the best interest of the child. That is a statutory requirement right out of Chapter 48 and 938, that those need to be the focuses of child welfare and youth justice. The intent in my conversation with Director Tilka is that, there are always things, much like what you heard in each of the presentations before, there are mandates that we have, and then there are things that we can do that are non-mandated but are innovative approaches to accomplish the ultimate goals that we have, which are to ensure the best interest of the child and ensure child safety. For example, we would be in compliance with the state law to place a child in foster care, however, to ensure safety. However, there's other things we can do, and things that Corporation Counsel and social workers work together, put in place protective plans. They can ensure that they can work to put in place a plan where another relative moves into the family home, or we send in family resource specialists on a regular basis, similar to what Deputy Chief Barnes referenced with checking on that individual every couple of days. We do the same thing in child welfare, and essentially what we're doing is we're moving that placement in terms of restrictiveness down. We're not sending the child to foster care, but we're doing perhaps an in-home placement with a safety plan. That would be in compliance with that idea of really putting an emphasis on trying to reduce the restrictiveness and the expense of placements. Where appropriate, of course. I think your focus on where appropriate is a very important piece that if you want to make it expressed, certainly would work. But I think you're right. I mean, certainly social workers are doing that already. Hope that helps.
Okay, so does your motion stand as is, Supervisor Krause, that you would like it to read by December 31st, 2024, there will be an appropriate reduction in out-of-home placement, or do you wish to include any of the items referenced by Administrator Leonard coming from staff at Social Services?
they have the data that they can give us for the results, right, on this. I like putting in the word appropriate reduction. And I don't have a problem with the 10% data-driven results provided.
Okay, so your motion is to add the word appropriate before the word reduction and leave
then-
everything as is.
Well, he was saying least restrictive.
Yes.
And that we can say that and social services will follow through with that, or that's what they do.
Yes.
So an appropriate reduction and least restrictive out-of-home placements, we could do that.
Oh, go ahead, Supervisor Arstead.
Lance, can you repeat what Vicki Tilka said just for more understanding of that?
Sure. Her suggestion was to include language similar to the following. Out-of-home care days will decrease with an emphasis on reduction of the most restrictive and expensive placement types to transition to more family-like settings. And just to build on that, the idea, as you move up in terms of level of restriction, oftentimes you move away from family-like settings to group settings, like a treatment foster care home or a group foster care home or again, as you move up, you'll have a treatment level foster care where it's a much more institutional setting. And the idea being, let's really work hard to get to the more family-like settings. Certainly there are youth that, based on their needs, are going to be in those placements.
Okay, so as it stands right now, we have a motion on the floor to amend outcome measure 2 to include the word appropriate before reduction, and then I believe an out-of-home placement to least restrictive out-of-home placement in Marathon County by 10% with data-driven results provided. So that is the motion on the floor. Is there a second to that amendment? Okay, so without a second to the amendment, then the motion dies for lack of a second. So then that brings us back to the current draft as it stands. Are there any other comments or? Go ahead, Supervisor Arstead.
I'd like to make a motion to include what Vicki Tilka has stated in what Lance portrayed to us.
Okay.
So I'd like to make a motion to do that.
Is there a second? Second by Supervisor Covelli. Is there any discussion? Seeing none, all those in favor of the amendment to outcome measure 2, say aye. Aye.
Aye.
Those opposed? All right, so that amendment carries. Then we'll bring it back to the draft as amended. Is there any other discussion? Go ahead, Laura. Could you guys hand Laura a?
I just want to commend the committee on looking at adding alcohol abuse as the evidence supports that alcohol abuse is actually continues to be a health priority within our county. The one thing that I would recommend looking at is on 3.7, number 4, measure trauma and suicidal tendencies and report results by the end of 2024, and reduce suicidal tendencies by 50%. I think you'll get a lot more information if we just slightly change that measure to look at data that we have available. And some recommendations I have for that are to look at maybe 5115 commitments, and if you wanted to even drill down to 5115 commitments of youth, you could even do that, or you could do all 5115 commitments. Another idea would be you could actually look at the incidence or prevalence of suicide within our community. It's very difficult otherwise to report on whether or not individuals are expressing suicidal tendencies. So those are my recommendations to the committee.
Okay, Supervisor Covelli, I believe that was a change that you had been interested in making. So are you or anyone else interested in making an amendment to that?
Thank you, Madam Chair. I think that, can you explain what 5150 and those are?
Sorry, I forgot that everybody doesn't automatically know that anymore. So 5115 is when an individual is a harm to themselves or others. So generally, it's a lot of individuals that, again, need inpatient treatment. And so it's an easy way for the county to be able to count that whether or not that individual is in need of this higher level of attention and care. And so when someone is under a 5115 commitment, and Matt Barnes alluded to it just moments ago, where what they do is they take the patient and they get them medically cleared and they take them to the North Central Healthcare inpatient unit. And then sometimes if the inpatient unit is full, they take them to another facility. But the intent is that that individual then gets this higher level of care. We actually collect that data, North Central does, and would be able to provide that. So it would be a nice way for us to be able to visualize data, and we can also get that over time, which I think would provide you with a really good understanding and trend.
Okay. I believe the administrator would like to make a comment.
Yeah, and building on what Laura said, that's when Deputy Chief Barnes was speaking chapter, when he used the word chapter. That's, and it's actually outcome measure number 1 in that same, for that same objective. By December 31st, 2024, emergency detentions in Marathon County will decrease, is the suggestion. Emergency detentions are kind of the gateway to commitment. So if you think about it, as Matt Barnes relayed, law enforcement will come upon, they'll have contact with me. I'm in mental health crisis based on their training and experience. I will be assessed by a treatment provider at North Central Healthcare, a crisis worker. They will say, Lance is in need of emergency mental health treatment. I will move under Chapter 5115, 51.15, and that will start that emergency detention process where I can stay for up to 72 hours. I have a court hearing. It starts a whole process. The end of that, if I go through that and I'm not suitable for voluntary treatment, is the legal commitment process that Laura talked about. And that commitment process is an obligation on the county, an individual, Lance, if deemed appropriate by a judge, if they find that I should be committed under Chapter 51 of the Wisconsin statutes, the county is charged with developing a treatment plan and monitoring my compliance. So when they're talking about case management, that's that monitoring of compliance part. So it makes logical sense. I hadn't thought about this before, but Laura's suggestion of essentially having a measure of emergency detentions on the front end, that you want those to decrease, and CART is a very good tool at doing that. But also then having a measure that says something looking at our performance for individuals on commitments, I think is also a good idea, because you don't want people to be in the inpatient unit, be stabilized, be placed on a commitment, and be released in the community, and then not compliant while on their commitment and kind of come back into the emergency detention system. So and I haven't given thought to what that measure could be, but I know we have data through North Central Healthcare and on Pulse probably that we can, if you'd like staff to bring back a recommendation based on what data we already collect, I'm always a big fan of that, because if we have to develop a new data collection measure, it takes a lot of staff time, energy, and effort. So, but I like the idea, because you're getting that front end, and then also it's that back end of commitment compliance. And I will be very transparent with you. That has been a struggle. Laura and I worked very closely when she was at North Central, trying to build that compliance piece for individuals on the commitment.
Thank you. Can you wordsmith that for us? If anybody knows me, I'm a data guy. I just like data. Show me the data, right? That's, without data, you're just another person with an opinion. So show me the data. And if you could wordsmith that, I'd like to make a motion, based on the wordsmithing that Laura has provided, that we change outcome measure 4.
Okay, we have a motion. Is there a second? Second by Supervisor Niemeyer. Any other discussion? Great. All those in favor say aye. Aye.
Aye.
Opposed? All right, none opposed. So that amendment has passed. Was there any other discussion before we vote on the document as amended? Supervisor Marash, could someone hand her a microphone?
Thank you, Madam Chair. Just a picky thing on 3.3 Outcome Measure 4 by December 31st, 2024, there will be an increased number of affordable, high-quality child care instead of spots, maybe options or facilities in Marathon County.
Okay, so you're just looking to change the word spots.
Yes.
Okay. Chair Gibbs, did you have a comment to make about that?
I was just going to say facilities, though, aren't necessarily the same as a spot or a place for a child. So facilities and
Yeah,
I think they're two different things.
I think the lingo is a spot. It's like an enrollment
You're looking at me
lot.
like you think I should have an answer.
I'm trying to remember from our conversations. Is it slot?
I think it's slots.
Yeah, I think I understand what I think both of you are getting at. I think clarifying the language as to what it's essentially a seat, right? It's a seat if kids in childcare were actually in seats when they're there, but they're not. It's a space for a child as opposed to, I think, to Chair Gibbs's point, I understand the increasing facilities is one thing, and we might be successful at that in a way that still wouldn't add overall spots if other facilities closed, whereas you might not add facilities but increase spots if you increase capacity within existing providers. So again, I think clarity from the committee in terms of what the goal is would help staff kind of push toward where you want us to go. My sense is you'd want to go to the spot
yeah.
or the slot or the seat or whatever.
So I'm engaged in the childcare community, obviously, because I have a child in childcare, and I believe that they just reference them as spots. So that is the lingo that I use because that is what I know. But the intent of that change was that there would be like an increased number of individual enrollment places for children. So the number of children able to be served increased, whether that's through more facilities being opened or more places within these facilities being opened. And I refer to them as spots. So if the committee wishes to change that language to something else, I'm open to it. That was just the word I used.
Understand. Thank you, Madam Chair. Just thinking about the structure of the sentence, could it be that by December 31st, 2024, there will be affordable, high-quality child care in Marathon County?
It could say that, but I would argue that affordable, high-quality childcare already exists in Marathon County. It's just
For the spots.
Yes, we are looking for more. We're looking for more childcare for more children to be available and having it be high quality and affordable. So I do think putting something in there about the number or we would like to see it grow.
Sure.
If there's a better way to word that without using spots, I'm open to it.
Yeah,
Increase capacity for the number of children served.
Yeah.
Increased.
Yep.
So there will be an increased capacity for the number of children served by affordable, high-quality childcare in Marathon County? All right, so do we have an amendment to change outcome measure 4 to what I just said? Okay, Supervisor Arstead with the motion, Supervisor Krause with the second. Any discussion about? Go ahead, Supervisor Covelli.
Thank you. Just curious on our outcome measure, what department, and this might be a question for Lance, is what department would that fall under?
Yet to be determined, but most likely I would see that being within the health department as a health priority, but I know Laura's going to look to me and say she doesn't have people to do that, and we need to identify funding. The data for that is already tracked, as Chair Van Cray referenced her involvement with the Dream Up grant that we're doing. Laura and I both also sit on that work group, I'll call it. That's maintained by DCF, and my recollection is Marathon County is short, is it like 4,000 seats, or is it 1,000?
I thought it was in the 3,000s, but I could be.
It's a lot of
Yes.
child care seats, slots, chairs.
Sure. So a follow-up to that, I think a lot of people are gonna, we're gonna get contacted about this. That this sounds like we're trying to get into the child care business. So if you want to address that, maybe.
Yeah, our group is it's been a very productive, I think, group in terms of discussion. But specifically to your point, we don't have a department that delivers child care services, and quite honestly, we have enough kind of business lines within county government that I wouldn't be looking to get into that business. I'd look to see, it's much like broadband and the work that you've all been informed about with how the county, what's the county's role in broadband. We are not a broadband deliverer. We're not an ISP, an internet service provider, but we have, since 2019, taken a much more active role. The county board has directed staff to take a much more active role in facilitating conversations and bringing people to the table to get them to deliver the service. I think that's what we would do. I mean, it's an outcome measure where we would convene, and that's what Laura's team does with a lot of these outcome measures. We don't deliver Marathon County directly. We don't deliver mental health services in schools, but Laura's team does convene a group and provide facilitation resources to help the school-based consortium do that. I would envision a very similar thing, and certainly, can I tell you that there's no way that we would ever create those positions? There's no way that I would create those positions. Your rules require you, the board, to approve that. So there's no way it would happen without coming back to the board, but I agree with you. I wouldn't see our role being a direct care role.
And I will just clarify that the number of spots, I'm going to use spots, in Marathon County right now, that is tracked by the state. So it is data that we already have. So we know how many we have. We know how many we are short based on the population and the need. So we would, I believe that we would easily get that data because it's being tracked by somebody else. It's not necessarily us that's tracking it, but it does exist out there. Okay, so we have an amendment to change outcome number 4. Is there any other discussion on that? Okay, so all those in favor say aye. Aye.
Aye.
Opposed? None opposed. So that amendment also passes. So now we're back to our draft document as amended. Are there any other? Go ahead, Supervisor Krause.
I have a question about G, continue work towards reducing truancy. I'm thinking that's sort of vague. I mean, it's a general term. Work is continue plans, continue programs, continue activities. I like that better than work because it doesn't really explain too much. There's all different kinds of work. So.
Okay, so and I understand you'd like to make an amendment to that one. I will caution that I think in this plan, it is in the strategic plan, it is better to be a little more broad than it is to be that narrow with our strategies, because if we say continue programs towards reducing truancy, does that limit staff to just looking at programs versus all the other things you mentioned? So if you'd like to make an amendment, you're more than welcome. I just wanted to make that point that if we make it specific, then it's specific.
Well, I'm not sure what kind of work the county is now doing to reduce truancy.
So there is, what is it called? Truancy court?
There is a fair amount of information relative to our truancy work in the 2020 annual update to the strategic plan. But the succinct version is if children are truant within Marathon County, there are two ways that county government can get involved. If they're exceedingly young children, I'm sure no one in this room that has a child knows this. It's a crime in the state of Wisconsin you can go to court for not having your child in school. Similarly, if the child is older, they can get involved in the youth justice system, the truancy court system, and a court action can be started. So those are the direct things. But we do a lot of work with local schools through our social services department to develop truancy prevention and intervention programs. So recently at the Criminal Justice Coordinating Council, and Chair Gibbs sits on that, as do I, we had a presentation from the Wasa School District, come talk to a presentation from a representative from the Wasa School District about the work that they're doing with social services to prevent and kind of interrupt truancy. And social services is really very much involved in that. So it evolves. Our truancy court process evolves over time, though it's not the same way that it used to be when I was a prosecutor and I would sit in truancy court. I think it was Wednesday mornings at 8 o'clock, and we'd have a bunch of kids come in and you'd talk about, the judge would read them the riot act, that if they don't go to school, these are the things that can happen, and they'd get put on an order. They'd have an order to attend school. So if they didn't do those things, they could have their driver's license taken away, a whole lot of other things, or be, in fact, placed at that time it was in secure detention or shelter home. Shelter home, I should say, not secure detention. But our approach has changed over time. So we do a lot. Social services spends a lot of time dealing with truancy.
And that is why that strategy was phrased as continue, because they are already doing work towards reducing truancy. So did you want to make an amendment on that one? Okay. All right. Were there any other discussions before we vote on the amended document to send it to the executive committee? All right. Seeing none, all those in favor of approving the amended strategic plan document, say aye. Aye.
Aye.
Opposed? None opposed. Okay. So if I'm looking at our agenda correctly, item number 6, operational functions required by statute, ordinance, or resolution, none. We already went over agenda item number 7. So moving on to item number 8, next meeting time, location, announcements, and agenda items. 8A, committee members are asked to bring ideas for future discussion. 8B, next scheduled meeting is Wednesday, October 5th at 2022 at 3 p.m. And brings us to item number 9, adjournment. So do we have a motion to adjourn? Motion by Covelli, second by Niemeyer. Oh, go ahead, Supervisor Gonering.
Supervisor Gonering, I second it.
Okay, thank you. All those in favor say aye. Aye.
Aye.
All right, we are adjourned. Thank you. Do you want to send that